And I'll let you know, Rabbi, when I'm just starting to let people in now.
Great.
Hi, everybody. Welcome.
Hello, everybody. We're going to just take a second to let everybody come in.
People are still piling in, so we'll give it another second.
Yep.
Okay, Rabbi, I think we're good.
All right. Thanks, Adrienne. Well, welcome everyone to this very important session, the first in a series, as we educate ourselves, learn, and become allies of the trans community. I just want to say that I personally don't understand the vitriol and the antagonism, let alone the political advocacy against this community. It really is a mystery to me. I understand prejudice and bigotry, and I understand the fear that generates it. But this community, it is so vulnerable to begin with. It just seems to me to be utterly immoral that so much negative attention is directed at them. I've said before and said in the publicity for this program that we at Temple Sinai have had young people come out as trans as part of our teen program. And we've had other families join Temple Sinai from rather far away because they knew that we would be a community where they and their families would be welcome. So the purpose of these programs is, of course, education, but primarily it is about allyship. It is about reflecting who we are as a community, which is to say that we radically and affirmatively embrace and welcome everyone for who they are. And we meet people where they are. And we engage them and give them the blessings and the obligations of our spiritual community. So I'm delighted that you're here to listen, and I consider your presence here also to be an affirmation of those goals of allyship and embrace. I'm really grateful that Dr. Aaron Grotas is with us, and really, really grateful that almost Rabbi Emery Cohen Wallach is with us. As well. They are two people who are dear to me personally and people that I have tremendous respect and admiration for. And we're going to learn a lot from them tonight. So as they speak and engage, we hope that you will that you'll submit questions to us, which you can do through the chat function. Correct, Adrienne?
Actually, Rabbi, it's the Q&A function.
The Q&A function. So if you submit questions in writing through the Q&A function, then Adrienne at the end of our presentation she will ask them of our panelists. And now it's my pleasure to turn the floor over to Barbara Wallach, who will introduce our distinguished guests.
Thank you, Rabbi. Good evening, everyone. So let me start with Dr. Aaron Grotas. Dr. Aaron Grotas is a board-certified urologist specializing in male and female urinary issues, as well as gay, lesbian, bisexual, and transgender services, and a number of other areas of specialty. He has authored many articles in peer-reviewed urology and radiology journals. His list of professional accomplishments exceeds what I can cover here, but you can look Dr. Grotas up on Google and read the rest of what is quite impressive. But what you won't find on Google is that back in 1990, when Aaron started his freshman year at Hewlett High School, I started there as well. And I was his guidance counselor. He achieved outstanding academic success and was immersed in student life as editor of our school newspaper. I think I'm right about that, Aaron. A leader in student government and Model Congress, and a lot more. It should be no surprise that Aaron went on to an Ivy League school and eventually to medical school and beyond. And it should also be no surprise that Aaron and his wife, Jana, are immersed as leaders at Temple Sinai, within the Temple Sinai community. And they just, I think within the last couple of weeks, celebrated the bat mitzvah of their daughter, Reese. So Aaron, congratulations to you and your entire family. And now we'll move on to my nephew, Mark's nephew, Emery. Emery Cohen is in his second year at the Reconstructionist Rabbinical College in Philadelphia. And as we were talking before we began, we're very happy to have Em on the East Coast. He's a California boy. He's on the path to a master's degree in Hebrew arts and letters, as well as rabbinic ordination. And he is also a graduate of California College of the Arts and an accomplished furniture maker. Emerging out of Emery's experience of gender transition, he is most interested in studying and making art objects created from already existing materials. I hope I said that correctly. Emery loves Jewish mystical traditions that treat the Hebrew alphabet as the building blocks of the world. At RRC, Reconstructionist Rabbinical College, Emery is in the process of investigating the power of Hebrew letters and acquiring tools to co-create the Jewish future. And while being transgender certainly does not define Em, our family has been able to see that he has become and continues to become the person he was meant to be. And so now I will turn the program over to our distinguished speakers. And I apologize, I'm hearing an echo here. I apologize if anybody else heard the echo.
Well, Barbara, that was a beautiful introduction for both myself and Emery. And I have very fond memories of you being my guidance counselor. Really so nice to connect with you after so many years. And I'm going to let Emery speak first. It's my honor to speak first. And I think that part of what we're all here tonight to do is to learn about the trans community and about the individuals and how we hear about in politics, we hear politicians, we hear on news programs, politicized everything is. But what my personal experience has been when interacting with people who are trans is that just like anybody else, trans people are real people. And I think that is the key, is that this is a human connection and we are all human beings. We all have the same rights. And I'm going to go first, and then I'm happy to do some sort of medical background for people, talking about sort of, you know, what the population studies are and stuff like that. I'd like Emery to go first and just share a little bit about what's going on.
Yeah, thank you for sharing this panel with me and for inviting me into your community for this evening. I want to start this panel by saying I acknowledge that I am the one transgender person in the room, or in this panel, excuse me, and my experience, I can only speak for myself. I can't speak for like the whole, you know, transgender experience or everyone's experience. But I'm happy to be a resource and happy to speak from my own unique experience. I am 27 years old. I started medically transitioning around the age of 18 and socially transitioning a little bit before that. And as I've grown older, I've felt the ways that my gender transition and my Jewish identity have been deeply intertwined. And so I'm really grateful for the ways that I get to, or I'll say I'm so deeply grateful that this conversation is happening in the context of a synagogue and happening in the context of a Jewish community, because for me that's an invitation into a Jewish community, and I hope that this panel will also be an invitation for other transgender individuals into Jewish community and into our Jewish community here. And I am happy to ramble on, but I'll open up for more specific questions as we get a dialogue going, as people have.
Okay, so let's just talk about, we all sort of kind of been exposed to the words, but what does it mean to be transgender? And, before the 1960s, people would talk about transsexualism and really talk about, fetishes and things like that as the reference point. But being trans isn't about how you were born, but it's how you identify. And transgender people, it doesn't mean that you've necessarily had surgery, and it doesn't even mean that you're on sex hormones to change things. So I think there's some preconceived notions that everybody who's trans has had a sex change or had major reconstructive surgery, and it's really not the case. I think that the first thing we should talk about is, what's going on in terms of these labels and these names. And, like everything else, it's a spectrum. It's not just one term or one type of person. So Emery, do you have any about that, or you want me to continue?
Sure, no, I can speak a little bit about it, and I think actually the labels for things have changed even in my lifetime, and the labels continue to change very quickly, because as people gain a vocabulary of terms to describe themselves, these terms are going to evolve. When I think of what being transgender means today, or at least for myself, it means existing outside of the gender binary, or existing, or excuse me, not existing outside of the gender binary, confusing terms. I think of transgender as being next to, oh gosh, I'm actually really struggling. I'm like, how would I define this today? Because I wanted to fall back on some things I used to say before, but I'm realizing even recently these terms have really updated. So maybe I'll say there's cisgender people in the world, and cisgender people are people who identify as the sex that they were assigned at birth. So if someone is born male, a doctor really makes a determination that they're born male. They identify that way throughout their life, and that continues as a cisgender person. If somebody is transgender, that person identifies in a way that is outside of their existing, or outside of their sex assigned at birth, is maybe the most expansive way to say that. And transgender can be a very big and broad term. It can be almost an umbrella term to describe people who maybe don't conform to the gender binary and don't identify as either male or female, or it can be somebody who does have a binary gender in the sense of transitioning from female to male or male to female. It can mean all sorts of different things.
So that's a great point. So I think that let's take us one step back, and then I'll just from medical school, so there were genetic males and genetic females that are assigned at birth, and there are some people who have both secondary sex of males and females, people who are intersex. So they have either they look female, but they're genetically, if you check their DNA, they resemble a male, and vice versa. There are a bunch of different genetic conditions. So these are not this whole concept that, some isn't gender fluidity is completely wrong, because this is stuff that's been going on for thousands of years. but also since the beginning of time, there have been genetic changes that happen to some people when they're born, or that they express secondary sex characteristics that may be different than their DNA. So anyone who's saying, oh, well, this is a made up concept, this is made up by liberals, it's completely false. Now, in terms of, you brought up this concept of non-binary, and even when I started to learn about and get involved with the trans community through Beth Israel, which is now part of Mount Sinai, this took a little getting used to figuring out what these terms mean. But non-binary really means that there's a person who, whether they were assigned male or female at birth, they don't believe that either category really fits them. So they may be masculinized, they sort of be leaning towards male or leaning towards female, whether they were born that way or not, but they really are, their gender identity or their sort of the way they see themselves in the mirror. And I think that's a key concept, because part of this gender identity is not necessarily what your genetics are, but how do you see yourself and what would make you feel whole. And I think that is, at least from my understanding, that's kind of what is going on here. And non-binary are people who they don't like either category. So they don't envision themselves as really being in either the he, him category or the she, her category. And they come with different pronouns, right, Emery? So some people don't like the standard normative pronouns that cisgendered or people who were assigned their sex at birth, and that's how they express themselves. They don't want to use those same pronouns, correct?
Yeah, that's exactly right. And people who may be non-binary might choose to use they, them pronouns to describe themselves. There's an additional set of pronouns called neopronouns that were just highlighted in an article released by the New York Times recently. And there's pronouns Z0. There's all sorts of pronouns that somebody can choose to refer to themselves that aligns more closely with their gender identity. And I think that piece also has a lot to do with how you want to be reflected or seen by someone else. What kind of personal connection are you making, and how are you hoping that people perceive you in that connection?
Great. So I wanted to share a couple of statistics because, we hear a lot about, oh, this is there's no one really who identifies this way. It's a liberal media projection. So in a survey of all people in Stockholm, Sweden, 0.5% of the population identified themselves as ones who would like hormones or surgery to change to a different sex. So that's 0.5% of all people surveyed. And then more like 2% would they felt like they might be in the wrong sex, or they would want to live as the opposite sex and take sort of some type of transition at some point. In Brazil, 0.7% or 7 out of 1,000 people identified as transgender, and another 1% identified as non-binary. In New Zealand, a little over 1% of high school students, there were over 8,000 students surveyed, identified as trans. And then in a recent Minnesota survey, over 2% of children 14 to 18, and there were thousands that surveyed. So over 2% reported to be trans or non-binary. And then the biggest study was a study of youth at risk of over 120,000 high school age students in the United States, and 1.8% of the youth that they were transgender, and another 1.5% were questioning their gender and potentially wanted to explore gender transition in the future. So I think that of adults, we're talking about a little less than 1% of the population, and of teens, we're talking at more than 1% of the population identifies as trans or non-binary. And that's in several countries, in different demographics as well.
If I could ask Dr. Aaron, as a follow-up to that, I'm curious, as a physician, at what point in transition, if someone chooses to transition or if they're thinking about transition, does someone meet with you, or do you meet with others?
Sure. So I'm a surgeon and only really see adults at this point. There are some surgeries being offered to late adolescents, but really in a majority of major centers in the country, the idea is that during or at the beginning of puberty, if children are questioning their gender identity and really believe that they want to transition, the first step is block puberty. Give them a chance to put things on hold, because developing these secondary sex characteristics for a woman assigned at birth or a male assigned at birth will be very harmful for them. And a lot of the thought process behind this is that these kids get very anxious and very upset when puberty arises, because their puberty or their development of their secondary sexual characteristics is really bothersome them and makes them very depressed and anxious and sad. And Emery, maybe you could talk about, either with your experience or with friends of yours, in terms of if those are kind of things that are generalizations that make sense to you.
Yeah, I mean, I think there's a large part of me that is screaming, yes. I can relate to so much of what you've said and heard so many stories that really align with that. There's another part of me that wants to challenge slightly, just because I hear so often, I think the trope in the media, or what's sensationalized in media often, is a story that trans people are necessarily born in the wrong body and really struggle and go through a pained experience to become adults or to transition into the gender identity that they see for themselves. And there is this kind of anguish and depression and period of anxiety that occurs. And I think that's often the case, to be truthful. And I don't want that to be the norm of what has to happen. And that's not the only story that gets told. I know a lot of, I'll speak for myself, that it was having an identity, an internal sense of gender and identity, or actually what first developed for me was an internal sense that something was off. I didn't have the words or the terms of the language to really say, oh, this is an issue of gender identity, or oh, this is an issue of disconnect between hormones and sense of self, or other expressions. But what I hope is that through the work that you're doing, physicians like yourself who are working with trans individuals and intervening from a place of great care and knowledge, that you can support individuals and prevent them from going into that place of depression, because it's a very difficult place to be and a very hard place to come out of. And I think that it doesn't, I'm so excited for the day, and I really like Kenya here. And so may it be the day that the process of transition is not so painful, and that people are ready to receive trans people in their transition, and physicians are knowledgeable enough to care for them and provide adequate medical assistance. And is part of why I'm really excited about our panel. And one thing I am curious to talk about is because in truth, I am just like really excited to be having this conversation with a physician. I have the knowledge of a personal experience, but you have the knowledge from this other medical side of things. And I'm curious in situations of hormones, something we talked a little bit prior. I have a question about how do hormones change people's experience of themselves? And from there's the physical standpoint, but also have you seen an emotional change in people when they start taking not just hormones, but any kind of gender affirming act for themselves and taking steps towards that transition?
So, in terms of as a urologist, I'm also a hormone doctor. So especially for male or for trans males, I have a lot of experience with testosterone. And we have a lot of experience showing that even for, let's say, 2 weeks, we take patients off hormone for surgery, and they get very depressed. So even patients who've been very stable, even after transition, we've been really trying to get people back on hormones quickly, because it's so important for them to feel whole once they've already experienced it. Now, in the beginning, if you think about it, this is really like, I would view it like your phone. Like if your phone battery is always dead and you don't have a charge, and then suddenly someone is able to charge you up and you have full power again. I think that that's a lot of the hormonal therapy does for trans kids and for trans adults. And I think that it empowers them to experience what it's like both emotionally and physically, to be more matched with how they want to express and how they want to feel.
Yeah, I think actually what you're saying is I'm getting, in a good way, I'm getting flashbacks to when I even had my first injection of testosterone and feeling so energized. And I think actually hormone replacement therapy and gender confirmation surgery actually made it possible for me to pursue an education as an adult. I think going from, and we've talked about this prior, and I hope we bring some of this in too, is getting young people set up with adequate healthcare before going off to college, whether that means hormones, whether that means surgery, whether that means just even like, emotional support. I think that, the right kinds of intervention can mean the difference between being able to feel anything, being able to feel happy and connected to people and emotive, and being able to pursue an education. It can, I can't emphasize enough how much gender from a medical standpoint and non-medical standpoint, how much steps towards transition opened up a whole new world for me that was not possible otherwise. And all I want to do is advocate for people to get what they need, because I know it can just open up whole entirely new worlds. And I think there's a fear sometimes that going on hormones or something is going to change people in a way that people will become unrecognizable to their families or unrecognizable to their friends. And that's really hard for me to think about, because for me, it's like, oh, but now I'm finally actually being seen. Now we can actually have a conversation. Now we can realize what our connection is to each other. And I can be so much more present for you in conversation, and you could be so much more present for me. And I think that I think that that kind of opportunity is like so precious. And for a while, I know when I was younger and starting to transition, that was not as accessible as it is today. It was a much more arduous process to access hormone replacement therapy. And I'm curious about what are those resources that are available today.
So I think I can really mostly speak about New York because that's where I practice. Um, we have very good pediatric as well as adult providers who are interested in helping in the mental health side as well as on the medical side to provide a breadth of resources. And I think that the key is to first start with mental health. And a lot of what is being said by politicians to try to shut down transgender care is that you walk in, you get a shot, and then 6 months later you have surgery. And what typically happens is that there's at least several meetings with a therapist or several meetings with a psychiatrist where they're really trying to determine, is this child or this young adult able to make decisions for themselves? Are there other things going on which are not to the surface yet before that need to be addressed beforehand? Or is this patient really ready to transition? And then there are meetings with doctors or other providers who can help either with puberty blockers or with hormones, depending at what is age appropriate and what makes sense. And I think that the key is that everyone is so focused on, oh, these parents don't know what's best for their kids. But I think that anyone who interacts with most parents knows that the parents are there for their kids. They really want to do what's best, and they want to try to be supportive. And what's the most heartwarming, when I perform surgery on somebody and both parents are there, or one of the parents are there, it really just warms my heart, because that I would do for my children, or I would expect my parents to be there if something were happening for me. And to know that that network is still there really is the best thing for the mental health of the person, to know that they have a community, whether that's their natural family that they're born into, or friends who act like family. But I think that part of this is the politicalization of all of this stuff has taken a lot of the human aspect. And when, as a doctor, we see people and put them on hormones or keep them on hormones, it really does a lot of benefits for their mental health. However, I think that the key, just like any other part of treating a person, is that they have a good support system, that they have people they can communicate with who see them for who they are or support their goals. And I think that the human rather than medical aspect is the most important part.
Absolutely. And I agree with you 1000%. And I think even just to name my own hesitation, I think for a moment, even when I got asked to speak on this panel, knowing that it was going to be myself and a physician, my first instinct, I think, was I had a lot of fear, because I had a lot of trauma from medical providers and gender experiences that were not so welcoming and were not so warm and did not treat me with the same kind of human decency that you expect of anyone. And I mean, I'm truthfully deeply touched by you saying that for you would expect, for your children, you would go with them, have both parents with them in surgery, you would be there for your children if they were going through surgery. And I think that is the most heartwarming story, and often it's not the case. It's not what happens, and there's a rift between family and transition. And I know for myself, when I was a young adult and just starting to transition, I thought that my only option to transition was actually to leave my family for a while. And that's what I did. And it made it possible for me to transition. And I am so grateful that later in my life, I found a way to come back and that they welcomed me with open arms and warmth. But I also, wish that people would start having these conversations and parents would have these conversations with their children early so that you can establish a kind of um, a normalization or create an opening for children to explore their gender identity. And it may come up as a child, it may come up as a teenager. Some people don't have these feelings until they're adults. Like, you really don't know when it's going to arrive. But having that social support network of people who are going to see you through it is really what's critical. And whether that be, holding your hand through surgery or just being there to talk about names and emotions and just hold space. I think it's so important to have that social network, and that is really part of a holistic view of transgender healthcare. I think that is forgotten in a lot of places, and I appreciate you bringing that into the conversation.
And one thing I wanted to talk about, because we're still talking about kids, is there is a real difference between kids who identify as a different gender and kids who are interested in role playing and exploring just their identity. And if a boy wears a dress when they're trying on costumes, or a girl puts on a masculine outfit, that doesn't mean that that's a gender change. And it doesn't mean that there's any brainwashing going on. So I think we really have to, there's definitely a ebb and flow for young children, maybe 6 through 10, where they'll try and explore the other gender as just more of a plaything, and they really don't judge it. It doesn't have this big weight to it. I think that we're really looking, before starting any transition or blocking of hormones and stopping puberty, is a consistency. There's a theme to this, that it's not just a solitary event or a small snapshot of time, but to start a gender transition from a medical or psychological point of view, it really should demonstrate both that the child can consent, that they really are making a conscious choice that that's what they want. And the second thing is not just a conscious choice, but that it's a consistent choice, that it's not a whimsical thing that they decided one day to try it, what have you, and then they went back and forth. Because this is what is being accused of these parents as being abusers or being horrible people, and that the state or the government knows better, or the school knows better, because they have these notions that, oh, the parents are just giving into their children whatever they want. And I would say that most transgender families I know, that's not the case at all. That there is a lot of denial and resistance, or at least they kind of look the other way and kind of hope it's going to be a phase. And kind of, it's been for a year or two, it's not a phase anymore. So I think it was just worth making that distinction, because there's a lot of people think, it's just a change for a day, that that's definitely not a gender transition, and it's not. But there definitely are some of this as well.
Oh, definitely. And I think absolutely there's an art to it, and I think opening up that the possibility for that exploration is so important, even if it is just for a day, because that might actually teach you something about, or teach a child something about their gender in a different way. But definitely to look for that consistency, and to trust your child, to know. The parent-child relationship is so hard, and I only know about it from the perspective of being a child. I don't know about the perspective of being a parent, as much as I try to empathize with my parents and see their vision, especially as I get older. And I think we are, ultimately we are made up of the stuff that is our parents, but we're not the property of our parents either. And so trusting children to make decisions as autonomous individuals, and to know that their transition is their transition is for their self ultimately, and that is a choice that they get to make, and the parents' choices if has a choice to support that or not, but I hope that they do. And I think bringing it up early and having these conversations actually allows also for parents to interject their own sense of morals and values and ethics into the conversation rather than children learning that from other places. We can also have the potential to bring in Jewish values. And I love what Rabbi White said earlier about radically and affirmatively embracing people for who they are. And I really do think that's so critical. In I'm curious about if there's also the opportunity in that. I think Rabbi White, you continue to say about also giving those people a sense that we embrace for who they are, a sense of obligation to their own Jewish community as well. And I think that is also so important to say that there's also a role for you here and you are held to the same Jewish values. And by saying that we hold you to the same Jewish values, we're saying we recognize you as a Jewish human being. And by saying we recognize you as a Jewish human being, we say we recognize you as, part of our community. And I think that's really the crux of what this is about.
Well, I just want to say thank you. I'm so inspired by both of you, really. Emery, for your being so honest and transparent with us. I mean, I think it's clear for everyone here that you're going to make an amazing rabbi in a few years. And Aaron, you know how I feel about you. I just love you and adore you. And I think it's just really extraordinary that you have chosen to devote your immeasurable talents to this population that so desperately needs doctors like you. I just have a couple of questions for each of you. So Emery, I want to start with you. You live in Philadelphia. We are in the Northeast. We're in New York. You're in Philadelphia. Are you comfortable sharing with us some of the challenges, maybe some of the pushback, bigotry, some of the maybe even innocent nastiness that you experience, the spectrum of what you experience? Like, in other words, what are the things that we need to be aware of that folks like you, even in 2023, experience?
Yeah, that's a great question. And I have to say, I'm coming at this from a very privileged perspective of there's a term that I really struggle with for a lot of reasons, but I'll use it here, called passing. And it's the idea that somebody is perceived, if somebody who has transitioned from, I'll say for myself, I transitioned from female to male, passes as someone who's male. If I'm walking on the street and someone passes by me, they're going to probably read me as a man and not think too much of it, unless I'm in a situation where I'm more vulnerable than that. And so more recently, I haven't gotten as much of that outward transphobia, but there are definitely still microaggressions that happen everywhere. I think that, some of the bigotry I've seen has actually started, like I was a Hebrew school teacher recently for a few months for a third grade classroom. And actually it makes me kind of sad to say it, but like a lot of the bigotry, I had one trans student in my class whose mother wouldn't use her name and wouldn't use her pronouns and things like that. And that was very painful. And that was very painful for the child, and also very painful for me as child's teacher to hold. And maybe that's, also from my personal experience, but there are those interpersonal, interfamily dynamics that I think are still very prevalent and the most prevalent. And then just out in the world, I mean, receiving healthcare is really hard because I just went to, I just went to get a passport. And at the passport office, I had to hand in a stack of papers this thick proving that I was exactly who I said I was, and my name was correct and my gender was correct. And I handed in every original document stating who I am that I absolutely own. And after I handed in all of these documents, the person across from me said, "Oh, these aren't yours. You have the wrong paperwork. Like, this isn't for someone else. And I said, oh, no, really, this is, I know I look a little bit different, but that's me. And the look on her face was a one of surprise. But, and you know, I've learned to kind of build a little bit of a shield around those things, but it also kind of hurts that you work so hard to say, this is who I say I am. And someone across the desk comes to you and say, you're not who you say you are. That really hurts at the end of the day.
Yeah.
I'll pause for a minute.
Yeah, thank you. Thank you. Aaron, for you, I'd love you to talk a little bit about what motivated you to choose this particular specialization. And then, you know, similar to the question I asked Emery, what are the things that you see today that really concern you? You know, in other words, about this population and about what they're experiencing, about the challenges they face.
Those are great questions. So, so this kind of, stumbled upon me about 7 or 8 years ago. I was at a committee at Beth Israel Hospital in Manhattan, which was forming a kind of transgender medical and surgery. And they said, will you be on this committee? And a lot of the other urologists mostly do cancer surgery. And they were like, oh, you should do this. And why don't you? And I was like, all right, fine. And I just kind of stumbled upon it. And we ended up a couple of years later, after talking about this stuff being Mount Sinai, and I started getting interested because there was such a need for surgeons at skills institutions to be able to provide expert care. And now you can go to most academic medical centers in the United States and get transgender care. But even 5 years ago, it was very few and far between. There was a doctor here, a doctor there who worked in a private clinic. Maybe there was a chest or breast surgeon here, a gynecologist there who knew a little bit about it, who could help you. But no one comprehensive program. And there was a program in Boston. Joshua Safer came down from Boston and to work at our center at Mount Sinai. He's an endocrinologist. And we ended up our own plastic surgeons, our own gynecologists, our own urologists to create an expert center. And what we had to do is we had to fly in world experts from all over to get experience, and we would fly to them. And it was a great educational experience for me because as an adult, I had stopped training already, and it was fascinating to go and then learn certain things that I didn't think I was learn how to do. And it's been very insightful for me. Now, your second question was about what do I worry about this population? And I think that this population is very at risk. And the reason why is because the medical and surgery therapy that this population, that trans people are getting, is essential to their way of life. If we were going to not allow people to eat or not allow people to have energy, that would be considered cruel and unusual. And if we are going to tell patients who identify as male or identify as female, we're not going to let you have these hormones that make you feel like yourself, that make you feel safe. How would there? And in addition, the surgeries are the same, because whether it's a voice surgery, a chest surgery, these are surgeries that are able to provide patients with this sense of well-being that they need. And they are essential functions. And thankfully, they're not being done in the shadows anymore. The fact that we do them in major academic centers is a real step because we have accountability. We are able to provide reproducible results. And even though there were great doctors who were trying to do this in Colorado and Arizona in their own private clinics, it's much safer for patients to have expert care done at expert centers. And then you can compare the results just like you would for an open heart surgery or something else, because the whole principle behind this stuff is that the transgender population, trans people, deserve the same high quality care as everybody else. And the nice thing is that the plastic surgery community, because there's so much work to be done, a lot of plastic surgeons have embraced the trans community. Not all, but a lot have, partly because there's a huge opportunity in terms of working on the outside of people's bodies to help them conform to the gender identity that they want. But I think in general, I think it's great because I think that there are so many more surgeons who are interested in training to learn how to do these specialized surgeries. And even though a lot of them have similar surgeries for cisgendered patients, they're not the same. They require an extra level of training, an extra level of care. And part of that's the emotional intelligence, part of that's the competency to be able to talk to people. But also the tissue is just different because of the hormones, because it started out in the opposite gender per se. So there are a lot of subtleties to this. And I think that this challenge really represents a new frontier in medicine. And I have urology colleagues in New York who are becoming some of the real masters of this craft. And it's because they embraced the challenge and because they were brave enough to do it when no one else was interested. And I think that is the key. And I think that's why Temple Sinai is unique, because even though other people talk about learning about this stuff and they talk about it, we're doing it. And I think that's really special. And I think having Emery here to share a personal and insightful Jewish experience, this is very helpful, because I think that it really kind of ties everything together.
Yeah, thank you. Emery, a question for you, and it really, it's as if you teed me up, Aaron. So even though we didn't communicate about this, but there are many of us, not just Temple Sinai, but I really do think the entire liberal Jewish institutional world wants very much to fulfill the sort of mission statement that I put out there at the beginning of this talk, which is to be radically inclusive and accepting, meeting people where they are, and to engage in genuine and effective allyship. But we're institutions, and so we fail at the things we want to do. So what would you like to see Jewish communities like ours be doing that would enable us to be able to say, with integrity, we are walking the walk?
Wow, that is a great and necessary question. I think one of the things that comes up a lot just in rabbinical school is lately we've been having conversations about B'nai Mitzvahs and about opportunities for students who are trans or students who may be gender nonconforming to have a B'nai Mitzvah, a bar, bat, or bar, there's many names, mitzvah, that aligns with the young adult that they're growing into becoming. I think that the transition from child to adult to be a B'nai Mitzvah in Jewish tradition holds so much weight, and we become a B'nai Mitzvah when we turn 13, whether we have a party or not, and yet the celebration and the call to Torah is a deeply meaningful experience, and I hope that that experience is something that can help young Jewish people grow also into their gender identity and their sense of self, and also that their gender identity and their sense of self being respected in Jewish community, and when they become obligated to these mitzvot that Jewish adults are obligated to, that they act in ways that align with these morals and values and ethics as well. I think other things are just creating, really what it is I boils down to maybe is two kind of core things of holding space as well as making space. And I think that some people really tout holding space, but you can't tout holding the space if you haven't created the space. They haven't created the container to hold people, and so there needs to be some kind of infrastructure within Jewish institutions. And I would love to see that commitment to embracing people radically and affirmatively for who they are in mission statements of Jewish communities, which I think Temple Sinai has really effectively, but not all Jewish institutions have. Making things visible, hiring queer and transgender staff, hiring queer and transgender service leaders, or inviting queer and trans lay leaders to come up and speak, because I think that something I didn't see enough of as a child was queer and trans elders, and that to me meant that I may not make it into adulthood. Like I was like, do queer and trans people just not make it there, and what's keeping us from living these long lives, and where are all of these queer and trans elders, and where is that wisdom and support and knowledge coming from? And I think that there is a Torah that only queer and trans people can tell, because that's just a very unique perspective, and I would love for that to be shared. But mostly I just hope that institutions follow the model that your congregation is you are walking the walk, and I want to see more people walking the walk is really what it boils down to.
I just want to say you took my breath away when you talked about not seeing elders, not seeing yourself reflected in elders, and therefore wondering, will I make it to be an elder? That literally just took my breath away, and is so incredibly tragic. And you're absolutely right. We have to provide those role models here, so that kids can see themselves in the mentors that we place in front of them. So thank you for that. That for me personally, that was just a very insightful moment. Aaron, I think my last question is going to be for you, and it kind of tees up our third session of this series. States around the country are prohibiting this kind of care. Centers are closing around the country. Families that have counted on medical care are suddenly without it. So my question for you is first of all, are you seeing patients that are coming from places like Texas and Arkansas and Florida? And second, what are you hearing from your colleagues in those states? Are you hearing anything about what they're going through? You're still muted, Aaron.
I knew it would get me one of these days. So that's a great question. I think that it's interesting with abortion. We've seen a greater demand, even in New York, for vasectomy, for reproductive choices, and we're just talking about cisgendered people now. We do actually do some vasectomies on trans patients as well, or trans and non-binary patients, but even in cisgendered patients who are worried, they're getting to a state where they won't be able to get an abortion. So I think that there is deep-seated fear. A lot of patients on the fence about whether they were ready to have surgery are trying to get their surgeries now in case they move to a different state later. We don't have a box yet, and I think part of that is that there's already a high demand in New York, and a lot of New York is one of the few states that has a high transgender population, and even just locally down the block at Long Island Jewish, they have a transgender medicine and surgery center, which was the first on Long Island. And I think that demand will continue to increase. However, as these political changes occur, we will probably see more people coming from these at-risk or unfriendly states. The subtlety with healthcare, though, is that especially if you're indigent and you don't have the funds, you are reliant a lot of time on the state Medicaid or the state-sponsored insurance. And for some reason, even patients from New Jersey who have a state-sponsored plan often cannot get surgery in New York because the way the funding works, they only will pay for in-state providers to provide the care. So we're going to probably end up seeing more patients who will have to come out of pocket if they leave the state to get their care, which is sad because we really have made great strides in getting a lot of these covered under medical necessity already, and patients do not have to rely on their own personal wealth or debt to get care. And now we may see a swing back. So that certainly is a risk of all these political movements that are going on now.
Well, to be continued, certainly, and you'll be hearing more. Those of you who are on with us, thank you for joining us and for learning with us. And there will be more sessions, and you'll hear about them. And Emery and Aaron, really thank you. This was, I think, such an important session for our community. And this talk, as I mentioned to you, will be shown especially to our kids as we go forward. And I think they will learn a great deal from what you shared with us tonight, as we all have. So I'm very, very grateful to you. And Barbara and Adrienne, as always, thank you. And again, thank you to all of you for being a part of this. Have a great night, everybody.
Good night, everybody. Thank you so much for being here. Thank you, Emery and Aaron. Good night, everyone.